The PANCO study was an international, multi-center, single-arm, open-label study to evaluate the safety and efficacy of the OncoSil device in a patient population undergoing standard of care chemotherapy for LAPC. The patient inclusion and exclusion criteria are shown here. Study interventions are shown here. The primary endpoint of the study was to assess the safety and tolerability of the OncoSil device. The key secondary efficacy endpoint was local disease control rate at 16 weeks. Other secondary efficacy endpoints include local progression-free survival at any site, and overall survival. 956 treatment-emergent adverse events were reported, 289 of which occurred before OncoSil implantation, and 667 occurring after implantation. 16 patients experienced 41 adverse events, which the investigators reported as possibly or probably related to the OncoSil device or implantation, whereas all 42 patients experienced 609 adverse events attributed to chemotherapy. OncoSil in combination with first-line chemotherapy for LAPC had an acceptable safety profile over a prolonged study timeframe, median follow-up 31.6 months. LDCR at 16 weeks was met in both ITT and PP populations. Although all study participants were initially unresectable, 33% of patients who received OncoSil implantation became eligible for resection. Almost 1 in 4 patients underwent surgical resection with curative intent. Compared to baseline, there were statistically significant reductions in tumor volume for patients who received OncoSil implantation. Median reduction in tumor volume was -51.9% in patients receiving OncoSil implantation. Metabolic response rate also decreased significantly, with total lesion glycolysis decreasing by -60.5%. Total objective response rate was 28% and 31% in the ITT and PP populations respectively. Mean pain score at study commencement was 2.0, suggesting relatively low and/or reasonably well-controlled pain at baseline. However, 17 patients reported moderate to severe pain at baseline. The mean change in pain score in those with moderate to severe pain at baseline was -3.3 prior to OncoSil implantation, compared to -4.7 following implantation. Median overall survival was 15.2 and 15.5 months for ITT and PP populations respectively. The study shows that OncoSil implantation has an acceptable safety profile and is largely consistent with the safety profile of that expected within a population receiving standard of care chemotherapy. The results suggest clinically relevant benefits of combining the OncoSil device with standard of care systemic chemotherapy for patients with unresectable, locally advanced pancreatic cancer. The PANCO study provides evidence that OncoSil may address a significant unmet clinical need in the unresectable LAPC population.